Mantle cell lymphoma is difficult. And first of all, it's not one disease, it's many different subtypes of mantle cell lymphoma. So there's the very indolent form, nodular form, and then there's a very aggressive form, the blastic form, where they really need different approaches. So I think it's important to have an excellent hematopathology review to make sure you know what you're dealing with, make sure that the patients are adequately staged, and probably discuss with some lymphoma experts really options for that patient. We need to make sure that they have a TP53 mutation done on their specimen, to know that they have adequate staging done, and to be able to look at clinical trials for those patients, because a lot of our standard therapies are not necessarily the best for each individual patient. There are some updated abstracts going to be presented at the meeting looking at Bendamustine Rituximab as a first induction therapy for kind of standard risk patients, followed by Rituximab maintenance versus those that are not. This is kind of a real world evaluation, and did demonstrate that Rituximab maintenance after BR actually did improve the progression-free survival and appeared to also improve overall survival in some patients. So that had been in question related to some prior therapy, prior studies that were presented. But this is a very large study that really looks like it does improve the outcome for those patients. So back in favor at the moment.